Happening right now. Millions of people are traveling for the holidays as the Omicron variant spreads across the country and the number of cases of COVID continues to surge.
Now, this is certainly one of the busiest days for airports across our country, including Indianapolis International, and that's where we find our Rich and I tonight.
And Rich, I understand you've talked to a lot of families who are coming and going today. What have they been telling you about their experiences as they travel across the country?
Well, across the country, airports are very busy today. Here in Indianapolis, it was packed this morning. That's the busiest time. Throughout the day, it's been pretty steady. Right now, actually, fairly quiet here at the Indianapolis International Airport, although still lots of people coming and going out of this terminal. Indianapolis, travelers here saying that COVID is not going to stop their travel plans this year, not like last year. And every hour across the nation, 100,000 travelers are going through airports. Santa is not the only one on his way. The Transportation Security Administration expects Thursday to be the busiest air travel day before Christmas in the United States. The Indianapolis International Airport projects over 16,000 daily departures on the busiest days during the holiday travel period. This couple and their baby are headed to San Francisco.
Just trying to stay safe and make sure the baby's okay and just keeping our masks on and all that stuff.
All that stuff is another holiday season of COVID concerns. The Raish family welcomed home their airman Caleb. They don't want him or anyone else in their family catching COVID in the air of family gatherings.
So we are really careful about who we allow kind of in our circle. We've kept the same circle the entire time, and pretty much all of us are vaccinated and have our boosters. We are very diligent about things just because we have family that's elderly, we have family that's vulnerable. We're tired of it, everyone is, but it's really important to keep people safe.
The Zamora family from Shelbyville must have a negative COVID test within 72 hours of their trip to Columbia Sunday. The airport offers an on-site testing facility.
I've been on the phone for the past 2 days trying to get everything. They changed our airline flight. That means we had to change our COVID test time to get our results back within that 72 hours. So that's been a headache.
Merry Christmas! Woo!
But the travel headaches are not stopping the holiday travel rush. And here in Indianapolis, actually Monday is expected to be the busiest travel day out of Indianapolis International Airport. That day projected about 16,500 departures from Indianapolis International Airport. And of course, the question is, after all those people have their Christmas gatherings and travel across the country, what is our COVID situation going to look like in terms of spread early in 2022? Scott and Anne Marie.
Yeah, that's a good question. Yep. And keep in mind, if you are one of the people that's going to be traveling on the 27th, you might want to plan early. It's nice that they've got early. That music at the airport, though.
That's helpful.
Yeah, some of that calming effect. Thanks so much, Rich. Well, you know, there are so many people flying, and we know that there are some families, maybe yours just like ours, that in wake of the cases and everything that's happening, maybe rethinking travel plans.
However, it is possible for you to travel safely. Dr. Anthony Fauci said today you should be okay to travel if you're fully vaccinated, you've had a booster, and you always wear a mask when you're in crowded places.
Keep in mind, with the number of people traveling, there are people with COVID at the airport and getting on planes. But it's not your flight, really, not the time that you're in the airplane that should concern you the most. No, a professor at the University of Illinois who studies public health and aviation says, really, his opinion is the riskiest part of air travel is the time in the terminal, the time before and after your flight. He says you're most likely to get infected while you're standing in line at security or maybe even waiting in line for a rental car.
You should also upgrade your mask. Find a high quality mask to wear, like an N95 or a KN95 mask. Researchers at Yale and Stanford found those were 95% effective at filtering the virus. Cloth masks were only 37% effective.
And here's a pro tip, too, for your family. After you get to your destination, just take a rapid test right before your family gathering, about an hour or two before you get together. That way you can be sure that you're not spreading COVID to your loved ones.
Well, the FDA has now approved a COVID pill treatment for emergency use for the second day in a row.
And this latest drug is from the company Merck, and it's called Molnupiravir, and it can be used at home to treat mild to moderate COVID in adults. It must be taken within 5 days of you getting a positive test. The data shows it can cut the risk of hospitalization or death by 30% for people who are considered to be at high risk. Many of our hospitals across central Indiana right now are filling up with more patients diagnosed with COVID than they've seen throughout the entire pandemic.